Let's move on and talk a little bit about healthcare. And I'm pleased to say that I think we have over 200 participants from healthcare for the healthcare track this time, which is a real great number. So thank you for joining us. In healthcare, the focus has really been around following medication and medical devices from the manufacturer to the patient in order to improve efficiency, safety, and patient care. And there's really been two major drivers that have been pushing this. The first has been economics. Reimbursement rates in the United States are driving extraordinary change in providers and wholesalers around how they use information, how they improve business processes, how they can leverage standards to become more efficient so they can remain financially sustainable and survive. And there's also a regulatory component of this. We know pedigree is coming in 2015. We know the unique device identification legislation is forthcoming any day. And the US pharmaceutical companies are working on traceability guidelines as well. So there's a strong impetus to come together as an industry from those regulatory benefits as well. And our focus has really been around continuing to get the community involved. We have over 145 companies in the United States, but more importantly, we've leveraged our global network of GS1 member organizations in many countries, 30 to be exact, around the world, where there's a healthcare group that's engaged and a global organization out of our Brussels organization, which has been fantastic. And the results thus far have been great. We have over 2,600 companies that are ready to use the GLN, the Global Location Number, and over 375,000 locations loaded in our GLN registry already. Over 1,000 companies are ready to assign GTINs, given the sunrise date of 2012 for GTINs, and over 360,000, GTINs already loaded into the Global Data Synchronization Network. But the story I really like to tell is about a provider you've probably heard about called Mayo in Minnesota and many other places that recently announced that they're moving over $725 million through the help of the GLN in their supply chain. $725 million. And when you think about the fact that many of those transactions that happen in the supply chain without a GLN are prone to be done incorrectly. And correcting them can cost anywhere from $100 to $400 per invoice. So we can quickly extrapolate the value that Mayo is receiving from conducting over $725 million error-free through the help of the Global Location Number, which has been fantastic. So those are the kind of stories that we continue to hear of for healthcare, and we would urge you, if you're not involved in this initiative, to please get involved. So here again, we have a short video that helps to provide a little more context on what's happening in healthcare. And then after that, I'm going to ask Mark Walchuk, president of McKesson Specialty Health, to join me on the stage and talk a little bit about what McKesson's doing in the healthcare space. So if we could play the video, please.
Preventable medication errors have serious effects on 7.1 million patients annually and cost the industry $21 billion each year. Counterfeit drugs are infiltrating the global supply chain more frequently than ever. Recently, a fake cancer drug was purchased by 19 hospitals and medical centers in the United States. Inefficiencies in supply chain information cost the healthcare industry $2 to $5 billion each year. But that's all changing. By working together, we're transforming the way healthcare operates. We're making it possible to follow drugs and medical devices from the manufacturer to the patient and trust that they're authentic. We're enabling supply chain visibility, lowering costs through increased efficiency, and delivering accurate information. We're improving patient care and safety, reducing medication errors, and linking critical product data to a patient's record. We're facilitating more effective product recalls, making it harder for counterfeit products to get to patients, and supporting regulatory compliance. Using GS1 standards, we're moving healthcare forward, together.
Good afternoon. Nice to hear that there's some healthcare folks in the audience. A little shout out to some of my healthcare colleagues out there. I'm not sure what happened though. Bob gets kind of the whole band. He gets the David Letterman welcome. And then he introduces Jim, and then I just have to walk up on myself. I'm not sure. I guess I drew the bad straw here. But really a privilege for me to have an opportunity to spend some time with you all this afternoon. My name is Mark Walchurk. I'm with McKesson Corporation. I work in our McKesson Specialty Health business unit. And for those of you that know McKesson, you probably have, or those of us that are part of healthcare probably have heard of McKesson, but those of you that perhaps aren't part of healthcare may not have heard of McKesson Corporation. And we like to kind of tell people that we're one of the largest companies that perhaps you've never heard of. McKesson really stands in kind of the center of healthcare, where we don't have really a consumer brand, but we provide products and services really across the entire healthcare continuum. And you can see some of just kind of the facts and figures up here. We really report out in two primary segments, distribution solutions, which is really kind of the core of McKesson Corporation over time, and really our core business being pharmaceutical and medical supply distribution. And then technology solutions, which is really our business focused on healthcare information systems and the use of software, clinical software in hospitals, in physicians' offices, et cetera. And I just want to take a minute again to talk a little bit about McKesson, then maybe talk a little bit about healthcare, and then maybe talk more specifically about why GS1 is such a critical element into healthcare and why McKesson is such a big supporter and proponent of the GS1 standards. So at McKesson, as I said, we're really a healthcare services company. We hope to think about standing at the center and working with all the various stakeholders in healthcare to really help them run and operate their businesses more efficiently. So whether it's a retail pharmacy chain or a payer or a physician's office or a hospital, we work across the entire supply chain with those types of entities in healthcare, and you can see some of the different things that we do. One of the things we're very proud of, I would highlight here, is really the investment we've made over time in business process and operational excellence through a Lean Six Sigma effort. And as you think about the supply chain that McKesson's part of in pharmaceuticals and medical surgical supplies, obviously the ability to do that very efficiently and effectively is very important, and that's really helped us to do that. Well, not only do we try to be very efficient in helping our business partners run their operations, but we also think that we have products and services and technology that helps our customers provide better care for their patients. And that really is kind of the ultimate mission that we have by being part of the healthcare industry, is really ultimately to help the broad stakeholders in healthcare provide ultimately the best possible patient care that they can. And what we do from a supply chain standpoint and from a technology standpoint, and specifically around standards, has a huge impact in patient safety and ultimately in providing better patient care. So that's just a quick flyby on McKesson. I want to maybe talk a little about what's going on in healthcare today. For those of you that are in healthcare, you probably would agree with me that healthcare is probably going through as much change now as it has in quite some time. And I've been part of the healthcare industry for almost 25 years, and I can tell you in my experience, I've never seen the type of rapid change that's taking place in healthcare today. And that's really the result of a variety of things that are going on in healthcare. There is pressure on the healthcare industry in this country from so many different factors, whether it's around cost, whether it's around quality, whether it's regulatory pressure, technology advancements, and even more importantly these days, the fact that patients and consumers have so much more information at their fingertips about healthcare, and that's added a whole new set of complexities to the industry. So the industry is facing rapid change and really facing pressure on many fronts. But with that, I think pressure and challenge, frankly, comes opportunities. And as we think about how healthcare will evolve and can evolve over the coming years, frankly, the use of technology is going to be critical to impacting better patient care, impacting reduced cost, and really the use of standards in the supply chain and certainly beyond the supply chain is critical in exceeding and meeting those expectations that the stakeholders have. And as all of you know, and certainly has been shared before, GS1 really kind of enables all the stakeholders in healthcare to get together in a safe environment, if you will, and really to develop these standards that can drive better efficiency and better patient care. So 3 key areas, and that Bob touched on it, and I've spoken already about them, patient safety being one, supply chain efficiency being the second, and certainly the regulatory compliance. And those are really the 3 key reasons why McKesson is so committed to the GS1 standards and just being very strong proponents of GS1 and organizationally what they're trying to accomplish. And Jim talked a bit about why he's here or why Darden is so supportive of GS1, and I would maybe answer the same question. I'm not a technologist. I'm not a supply chain expert. I probably know enough about both to be slightly dangerous, but I'm just a business person. And I think as we think about healthcare and perhaps some of the other industries that we're in, we need to make sure that as business people, we're driving the adoption of these standards. It can't simply come from the technology department or the supply chain department. It really has to come from the overall business, and I think that's really one of the key things in healthcare that's helped to drive adoption, but certainly how healthcare needs to continue to adopt these standards going forward. Just a couple of quick things around patient safety. It's a real sad state in this country, but literally thousands of people die every year from what are referred to as adverse drug events or errors that take place in a hospital. And those numbers have been reduced significantly over the past 10 years due to advances in technology and a real focus on patient safety. But the fact is that there are still adverse drug events that take place every day across healthcare. And really through the use of technology, of standards around medication, we can reduce that number and hopefully bring that number to zero. Bob touched on counterfeit medications, and I think in the video as well. Just a few weeks ago, it was front page news, I think, in the New York Times and the Wall Street Journal around a significant supply of counterfeit medications that are treated, a product that's treated in the oncology setting got its way out into the marketplace. So even today, we still face challenges with counterfeit medications. And again, the use of standards can help drive to ensure patient safety and reduce the risk of counterfeit drugs in the marketplace. The second area is around supply chain efficiency. And when we talk about this in McKesson or with other healthcare stakeholders, we talk about really kind of the patient care aspect of standard adoption, being almost kind of our duty. And if you're in the healthcare space, we have, I think, a responsibility to lead in terms of how we can support better patient care and better patient safety. But also, the business case around the ability to drive efficiencies in your supply chain is clearly there as well through the adoption of these standards. And certainly some of these things that you see here are things that all of you face every day in the work that you do in your supply chains. But certainly within the healthcare industry, there are literally millions of transactions that take place every day. And frankly, the use of standards helps to bring some order to that chaos that could exist. It also allows various stakeholders throughout the healthcare industry to talk on a common platform and with a common language, which is very helpful as well. The third area is around regulatory compliance. And certainly, every industry in this room, I'm sure, is facing tougher and tougher regulations and more legislation that affects your business every day. Healthcare, I can tell you, is no exception. And as you probably know, healthcare is one of the most regulated industries, I think, in the U.S. And literally, with the swipe of a pen, an entire industry can change in terms of what the requirements are to do business in healthcare. And I think one of the things that we talk about why our support, and we're such a strong proponent at McKesson around GS1, is not only is GS1 talking to companies in the industry, but they're also very involved in engaging the FDA and other regulatory agencies, industry trade groups, et cetera, to try to really bring all the stakeholders to the table, again, in a very kind of safe environment, so that the regulators can make more informed decisions, and that industry, frankly, can help influence and educate the regulators on the types of work that they're doing. And that results, hopefully, in regulations that are more impactful and give industry the ability to implement them more effectively. And certainly, as Bob touched on, California pedigree in 2015 is I think, a good example of that. So just maybe to close here, a couple key things. Certainly at McKesson, we're very focused on helping the industry further the adoption of these standards. And I think it will take a lot of leadership across the entire healthcare industry to do that. And there's other great examples out there. Bob mentioned Mayo Clinic. They're part of the Healthcare Transformation Group. There perhaps are some of you represented here today from those organizations. But it's going to take leadership from organizations like that, other industry trade groups, companies like McKesson and others, to really talk about the duty that we have I think from a patient care and patient safety standpoint, but also the business case that we have in terms of how we can make our operations more efficient and more productive, and through the use of the standards, we can certainly do that. So as we think about our support, in the short term, it's about how do we drive further adoption in the standards, and certainly longer term, we think about how new regulatory requirements will come into fold, how the healthcare industry will continue to evolve and change, and so having GS1 again at the center to foster and enable those discussions and to bring industry together, we think is crucial, and that's why we're such a strong supporter of this organization. So thank you so much for your time, and really appreciate it.
Mark, thanks a lot.